Hello everybody, this is Mark Hutten with myaspergerschild.com, and I recently received this email from a parent, and she says, I need any suggestions or advice. My son Jaden is almost 7 years old and has ADHD and Asperger's. Recently, he has become extremely destructive of his own things and violent toward family members. This behavior is a new thing, and we are clueless as to what might have triggered it. Any and all help is very much appreciated. Well, since difficult behavior stems from a variety of causes, it's going to be best to examine the behavior from as many different angles as possible. So you'll need to kind of do your own assessment. You need to assess what the payoff for engaging in problem behavior is. You also need to assess what your child escapes from, avoids, or gets by engaging in the problem behavior. Now, the reason an assessment is important is because it's going to enable you to identify workable techniques for developing behavior interventions. It's hard to fix a problem when you're not sure where that problem is coming from. So when doing an assessment, you're going to try to find answers to a few critical questions. Addressing these questions will lead to a more effective behavior intervention plan. So, here are some questions to ask. Are there any settings where the problem behavior does not occur? Does my child find any value in engaging in appropriate behavior? Does my child have the skills necessary to perform expected behaviors? Does my child realize that he is engaging in unacceptable behavior, or has that behavior simply become a habit? Does my child understand the behavioral expectations for the situation? In what settings is the problem behavior observed? Is it possible that my child is uncertain about the appropriateness of the behavior? Is it within my child's power to control the behavior, or does he need support? Is the behavior problem associated with certain social or environmental conditions? Is my child attempting to avoid a demanding task? Is there a more acceptable behavior that might replace this behavior? Is there evidence to suggest that my child does not know how to perform the skill and therefore can't? In this case, we're talking about anger control. What activities or interactions take place just prior to the behavior? What current rules, routines, or expectations does my child consider irrelevant? What usually happens immediately after the behavior, and who is present when the behavior occurs? Now, you don't necessarily have to have answers to all of these questions, but the more answers you have, the better your behavior intervention plan will be. And in addition, you may want to interview your child. Interviews with your child may be useful in identifying how he perceived the situation or what caused him to act in the way he did. So, in a nutshell, you're going to do an assessment to see if he's getting a payoff for his destructive behavior and his violent behavior. Is he trying to escape from something, avoid something? Is he getting something out of that behavior? And if you get answers to the questions that we just talked about, it'll give you a good indication of why he's choosing that particular coping technique. And by the way, his destructive behavior and his violence towards family members is his way of coping with something. You just need to figure out what that is. Thanks for the question. This is Mark Hutten at myaspergerschild.com.